Hello, I'm Antoni Chan. I'm consultant rheumatologist from Reading in the United Kingdom. And today I'm reporting from ACR 20 at the psoriatic arthritis abstract session. There has been a lot of interesting abstracts today at the ACR 20, but I wanted to highlight to you some very important abstracts, which I think will be of great clinical relevance to us, because one of the things that we hope to take back from the ACR is how we can practice this in our clinic. So one of the issues that we have in our clinic as we assess patients with psoriatic arthritis is to try to understand where the pain might be coming from. And sometimes we see a lot of patients who have joint pains, but it appears that they don't have a lot of tender or swollen joints. And one of the theories that we think about in psoriatic arthritis is where the actual disease starts. And so there is a concept of the synovial entheses interface, where this complex between the synovium and the entheses is thought to be the origin of where the inflammation starts in psoriatic arthritis. If that is the case, then we should think about how we assess in the early parts of psoriasis and psoriatic arthritis the entheses, or the organ that where the tendon joins onto the bone. And we need to find ways to try to assess this. Now, clinically, we have ways to do that by assessing the entheses, such as around the elbows, the knees, or the Achilles tendon. But what the study has shown today is abstract number 311. And I think this is of importance to us because they have used ultrasound to assess the entheses synovial junction. And they have found a very strong correlation with the power Doppler signal and the ultrasound signal at the junction between the joint, the synovium, and the entheses. And this correlates well with the clinical features and clinical examination found on these patients as well. So adding in ultrasound could be one additional way, especially in the early parts of psoriatic arthritis, to assess the entheses, where we also believe it could be the site of where the inflammation starts. Another challenge that we have in our clinic is assessing patients with fibromyalgia or coexistent fibromyalgia when they also have psoriatic arthritis. And many of our clinical scores that we use, such as the DAPSA score or the PsA score, can often be affected by the presence of fibromyalgia. And so when we assess this, there are very important things that we need to be thinking about. And in abstract number 315 today, there is a very interesting study that showed that if you had used ultrasound in addition to your clinical examination, that it can be helpful to try to differentiate what is inflammation at the sites of joint pain or tendon pain, as opposed to what is from fibromyalgia. So they studied two groups, one group with people with fibromyalgia and one without fibromyalgia in the context of psoriatic arthritis, and found that ultrasound was quite a sensitive way in detecting the difference between the two groups. And another study in abstract 313 also showed that ultrasound was very sensitive in picking up swollen joints, but less useful in terms of picking up tender joints. And in a way that helps, it kind of helps us to understand what is inflammatory and what is non-inflammatory sites of pain. And again, ultrasound in both these two abstracts could be useful for us in our clinical practice. And finally, abstract 314 again shows us that the ultrasound can be very useful, especially when we assess patients with psoriatic arthritis, as they have a mixture of joint disease, tendon disease, and also entheses pain. And using the ultrasound helps us to determine where's the source of pain in these patients. Is it the joint? Is it in the tendons? Or is it in the entheses? And that again can be quite helpful for us. So in addition to our clinical examination, our clinical use of our skills, ultrasound could be another useful way, especially in the early phases of psoriatic arthritis or in the patients who may have coexistent fibromyalgia, to try to tease apart this very complex condition where there's a mixture of not only tendon, but also joint and enthesial pain in the context of fibromyalgia. It can be quite challenging for us. So I think today's session and today's abstracts really has helped us to kind of tease apart some of these challenges that we have and how we can use other imaging modalities such as ultrasound in our clinical practice. So that is my kind of takeaway from the psoriatic arthritis session today. I'm Antoni Chan, and you can follow me on Synovial Joints on Twitter. And I look forward to reporting further as the ACR conference progresses. Thank you very much.